I see you've got your mask on.
Good morning.
I'm taking it off now just for this interview.
I'll take it off for the interview, yes.
Very, very good. Now, in hindsight, should it have been brought in sooner?
Well, what we've seen is that state authorities have been in a position to make decisions where community transmission levels are sufficient. What has occurred in Victoria is an acceleration of community transmission levels. So they have made the decision, they've responded to that, we've backed them in with an unprecedented level of support for what is a decision that is really unique in almost 100 years in Australia. So the Victorians have taken their steps and we're supporting them. Right now, we're focused on the next thing and the next thing. 1,400 military now on the ground in Victoria to assist with testing, tracing and isolation. And we're also making sure that there is support right across the aged care sector.
There is a suggestion, Minister, that the reason why there had been a change in language when it came to masks is because there was a shortage of surgical masks in the country. Is that correct?
No. What we've seen is the consistent set of principles, which is if you're not able to distance and you're in close proximity and where there is high community transmission, and what's occurred is that community transmission has grown in Victoria, and that's the reason that Victoria made the change that they've made. Okay. And there are different parts of the country in very different circumstances. It is a serious situation in Melbourne. It is a level which we're all concerned about. But right now, our task, our responsibility is to give people advice, support, legitimate hope, but to know that we will be going through a difficult time, but, you know, we're going to get there.
The Premier did mention yesterday, the Victorian Premier, that of the 3,810 Victorians who tested positive, 9 out of 10, Minister, kept going to work and they kept going to supermarkets. 53% didn't isolate at home after testing. What's your reaction to those numbers and why is the messaging not getting through?
Well, the message is... and I have to reaffirm this, that if you are being tested, you do have to isolate. If you are ill and showing symptoms, please stay away from work. These are the critical things that will protect us. The masks are an important tool to help protect us. The social distancing is a critical tool. If you can reach out and touch somebody, unless it's your family, you're too close. And isolation and testing are critical. I want to support and thank the Australian public. I think that they have done an amazing job, but now we have to do more and we have to be ever more vigilant. They're the things that will protect us and they're the things that will allow us to flatten that curve in Victoria for a second time.
You must be frightened by those numbers, though, wouldn't you be, Minister, that record yesterday, and also disappointed by the fact that people seem to be ignoring the warnings, the fact that they are getting tested and then going on and heading to work?
So I'm focused by those numbers, completely focused and obviously concerned, because they represent people's lives. They represent the fact that there are individuals who will be ill in hospital, in ICU, on ventilation, and some who will sadly lose their battle. For us, our task is to help people understand that they can get through this, but that each one of us through our actions can help save a life or inadvertently risk a life. And that's the message, whether it's to young people, to people who may not have isolated when they should have. Please do this, because it could be your mum or your dad, it could be your grandma or your grandfather. They're the people who will be most at risk through inadvertent transmission or something seemingly harmless, reaching out and hugging somebody who's not from your house. That could transfer this disease and sadly risk their life or take their life.
Okay.